everyone. Happy Aloha Friday. Welcome to today's webinar, Palliative Care and Hospice, Supporting End-of-Life Care, presented by Jeannette, Koijane, and Hope Young of Kōkua. So thank you all for joining us today. Before we get started, just want to give some Zoom housekeeping and some announcements. First of all, I want to thank the organizers for this training, myself, as well as the Hawaii Public Health Training Hui Steering Committee, which consists of 14 members of different partner organizations. Thank our sponsors, the Hui, the Western Region Public Health Training Center, as well as the Public Health Learning Network, who provided today's continuing education credits. Just a few Zoom housekeeping items. For all questions that you folks have, please utilize the chat box or the Q&A boxes located at the bottom of your screen. This webinar is being recorded and it will be shared on the Hawaii Public Health Training Hui's YouTube channel following this session. These are the 4 topic areas that are going to be provided for continuing education credits: CHES, registered dietitians, social workers, as well as substance abuse counselors. In order to obtain your credits, first you must register and attend today's webinar. Following this session, I will send you a Mahalo email with the link to complete your survey or provide your feedback. Those evaluations are due next week. Evaluation is due next week, Wednesday the 9th, by the end of day. So please have your feedback in. That's how I monitor and track for CEUs. Those certificates will be mailed out by November 18th. And for folks who are calling in, please email myself at makamai@hifi.org, including your name and phone number so that I have you on record to receive a Mahalo email. Without further ado, I'd like to introduce to you folks our guest speakers for today. Jeannette is the Executive Director of Kōkua, a movement to make conversations about improving care the norm, which is an organization she has worked with for over 19 years. First beginning while she worked at the Executive Office on Aging. She received her graduate degree in public health from the University of Hawaii and her undergraduate degree from Cornell University. Jeannette has worked in the U.S. affiliated Pacific Islands, helping to develop palliative care programs through a collaboration with the UH Cancer Center and John A. Burns School of Medicine. She serves as a volunteer advisor to Zahana, a participatory rural development project in Madagascar. Our second presenter is Hope Young, who is the Advanced Care Planning Coordinator for Kōkua, where she provides community awareness and coordinates the Let's Talk Story program for the Speakers Bureau. Hope joined Kōkua in 2017 under a generous grant from the Stubbsky Foundation. Hope received her bachelor's from the University of Hawaii West Oahu in public administration with a concentration in healthcare administration. Hope started in the healthcare field as a certified nursing in a dementia unit and later moved on to manage a home care agency. She has enjoyed working in various capacities with senior and the caregiving community for over 18 years. During that time, she has seen how important meaningful conversations and documentation can benefit families during time of crisis or illness. Hope enjoys being out in the community and sharing the importance of advanced care planning and hopes to someday normalize the conversation to ensure that everyone's end-of-life wishes are expressed and honored. So without further ado, I'd like to hand it over to you two.
Well, aloha, everyone. Thank you so much for the invitation to speak with you today. Hope and I are looking forward to this. And we've put together some slides that we're going to show. We'd love it if we're going to try and engage the audience a bit. So there's going to be some questions in the chat. Also, when we're going along, if we say something and it's not clear, feel free to put into the chat and we can also stop and make sure that those things are cleared up. And then also, as we go at the end, there's going to be time for questions and hopefully some discussion. So please be sharing your comments. Okay, so again, thanks so much for the invitation. I'm going to share my screen. Okay, so I'm hoping you guys can see me because I can't see you. So today we're going to talk about palliative care. Who is it going to be helping and where can you find it? So I'm going to start and then Hope's going to talk and we'll go back and forth this morning. So I wanted to start with who is Kōkua. We are a 501c3, so we're a community benefit organization. We work statewide. We are not a part of the state, which everyone in Hawaii always thinks, and we began way back in 1999. So we are going on 22 years of working in Hawaii to improve care for people with serious illness. We are a membership organization, which means as a hui, everybody kicks in a little bit and that makes things work. So we have health plans, hospitals, hospices, different agencies throughout the state, as well as individuals who financially support our work. And you are with the entire staff of Kōkua, but the way that we get all the stuff done that we do is by passionate volunteers. So there are a lot of folks out there that are very supportive of our work. And Hope and I, full disclosure, we get to work with the best people. So, and there's a plug if anyone would like to join, feel free. We'll give some contact information at the end. If you think, oh, this is something I really would like to know more about, I hope that you will contact us when this is over. So we like to think about the work that we do as a continuum. Full disclosure, as a public health person, I am always about preventing crisis, preventing a disaster. As Hope in her bio, we want these conversations to happen early. So we want people to understand about discussions that need to happen early. And then we want to make it clear what sort of documentation people need to do. And then when people are sick, what type of care is available? And today we're going to talk about palliative care, a little bit about what hospice is. Also want to make people aware that we also have resources on bereavement and grief. So we take this space that I will say a lot of people run away from, but we run towards. So we are very happy to be working on these issues. So again, as a good public health approach, we like to approach this challenge from three main ways, or three legs of a stool, if you will. We like to put people who may be facing serious illness and their loved ones in the middle of this. We want people who might be facing serious illness in the future or sooner understand what decisions they may need to make, and then find resources as soon as they can. So in our world, we say it's better to be 10 years too early than 5 minutes too late. And we hope that people can find these resources on our website. Most of the stuff that we have, as a matter of fact, all the stuff we have is free for download. We never want a firewall to be in between, people who need the information. And I do get emails. I'm sitting at my mother's bedside at 4 o'clock in the morning. Thank you for what you were able to do. So I hope people can go to our website, which is kokuamau.org, look and see what's there. We also have the website's very actively managed. We come out with newsletters a couple times a month that can help people to make people aware of new resources, things that are going on both locally and nationally. Hope and I really try to follow what's happening with national trends as well. So, and one of the things that Hope is in charge of is being out in the community and having conversations. So she's going to talk about that a little bit later. Number two, here we are today. We really want professionals to understand what the work is that we do and to link people up with training and networking. We know it's not easy to work in serious illness, and what we want is for people to feel like there's a hui of people that they can call on and people can ask. Now, Hope and I, but we want you to be able to integrate this information into the work that you do to help people in our community. And I will say more and more, my friends are trying to take care of their parents. They're taking care of auntie, there's taking care of somebody from the church. So we all know how that goes when you're in healthcare, that we are also watching out for each other. And then the final piece we work on is changing the system. So thank goodness there's not a lot of legislation that we work on, but I I do want to say that we are really interested in policy change. So we are interested in, so for instance, if HMSA decides to pay for palliative care, game changer. And we'll talk about that a little bit later. Kudos to UHA and HMSA for having a benefit that it pays for palliative care. The VA also changed how they did things, paying for palliative care. So we are really interested, and I'll talk a little bit later about hopefully a new benefit that MedQuest is putting through to get palliative care to MedQuest members. So we're really interested in policy change. And again, it's like with anything in healthcare, follow the money, and things can happen. So Kōkua Mau, we are leading a movement. We like to say that we're a movement. And we want to make these conversations about care and support for people with serious illness and their loved ones. And that includes end-of-life care, the cultural norm. So we look to you to be part of our team. We're really glad that you guys are here today. And we look forward to, to working with you. I realize I forgot to ask who's out in the audience. So why don't we have, if people could, as we're going, if people want to introduce themselves, put something in the chat, that would help Hope and I to see who's out there. But I will say we're going to have our first interactive activity, and that is an icebreaker. So we know that a lot of times people don't know what palliative care is. So all of you, we need your help. Put into the chat the first word or words that come to mind when you hear palliative care. What, no shame, and none of you are, no shame at all. We're not outing any of you. And hopefully you're here because you're interested in palliative care, but we're interested in what are the words that you, that you think of. So I'm going to.
Jeanette, I'm looking at the chat and it looks like we've got some responses as comfort care, pre-hospice, pain relief, end-of-life transition.
Good.
Optimizing quality of care. I like that.
Excellent.
Whole person care.
Good. Ending life care. That's we're gonna touch on that. Comfort versus treatment. Also interesting. Okay. Well, thank you folks for doing that. I'm gonna put away my chat so you won't see the box anymore. So this is our this is the creative wordle that comes out around palliative care. Communication, respect, love, support, decision-making, family, spiritual care. These are all things that we're gonna talk about this morning. So the first thing we're gonna do is watch a movie. Okay.
You are a bridge. It's true, or at least it's a good analogy. When you're healthy, when the bridge is sound, you can handle anything. Cars, trucks, trains, all the bumps of life, no problem. You are set. But if you're facing a serious health issue, something like kidney disease, lung disease, or cancer, the bridge starts to falter, cracks appear, and pretty soon it's hard to withstand all that traffic. Traffic that includes your own medical treatment. And that's where palliative care comes in. Palliative care is a specialized form of medical care, specifically designed for people with serious illnesses. Its main goal is to improve your quality of life by providing relief from the symptoms, pain, and stress that are an inevitable byproduct of both the disease and the medical intervention. In short, palliative care provides support for your bridge. And when a bridge is in trouble, there is nothing better. Now, palliative care, just like construction, is a team effort. It takes doctors, nurses, social workers, and other specialists, all working together with your physician to realize that extra layer, the layer that can make all the difference. It's a treatment method that makes sense at any stage of life and at any stage of an illness. because it's never too late to lessen the burden. So, next time someone you care about is facing a serious illness, remember this bridge analogy and be sure to consider the enormous potential of palliative care.
Okay, so hopefully that was helpful as a beginning, and the link or the page that they comes off of is getpalliativecare.org, and they have good resources, and we've linked to quite a number of those through the Kōkua webpage, which we'll show you later. So today what we want to do is to show how this extra layer of support that palliative care provides can help someone live well with a serious illness. So full disclosure, Hope and I participated in a national webinar on Wednesday morning where the results of some research that's been going on for the past at least 3 years was revealed. And the message, the point of the webinar and the point of the research is, how do we best talk about palliative care? Full disclosure, we are very frustrated that we have this great care that people are not taking advantage of. And so part of what we'd like to hear today also from you guys, we'll be asking for it. You can put it in the chat. What messages resonate with you? It is very frustrating when people say, oh, we didn't know about palliative care. I didn't want to call palliative care. So, hey, we need to figure out how we can help people understand what this care is so that we can help. So there's sort of two things to think about with palliative care. First of all, it is often misunderstood. So most of the comments that you guys had were really good, but you may be a self-selective audience that you showed up for this webinar. We find two things. This is local, but also national research, that palliative care is the same as hospice, super scary, not going to go there, or else they have never heard of it. So also not going to go there. So we definitely have a challenge of getting people to understand what palliative care is. And then the second thing that's important is that palliative care is a relatively new field that is still under construction, if you will, and still being defined. So some people will say, oh, yes, I provide, we have a palliative care program that's like a nurse who takes calls on a Tuesday afternoon. Well, for us, that's not robust palliative care, but they've decided to call it palliative care. And so we're in this really interesting phase of defining what palliative care actually is. And I think that we in Hawaii are really ahead of the game because we are using a very robust version of what palliative care is, which then also leads into what is going to be paid for, how are things going to be reimbursed, and what would a patient and a family be actually expecting to get. So here's a definition of palliative care. Palliative care helps people with serious illness stay at home rather than having to go to the emergency room or the hospital. Palliative care helps to reduce physical discomfort, improves the quality of life, and makes living with a serious illness easier. And this palliative care helps both the person and those who help care for them. I usually say loved ones. Sometimes people say family. Sometimes people have a bunch of other people besides family, or including the family who cares for them. And another thing that's important to say with palliative care is that the professionals who take care of people, they actually really like palliative care as well. So that fits in. So this is a little bit more of a more robust version or a definition that comes from CAPC, which is the Center to Advance Palliative Care, which is a medical academy. So palliative care is specialized medical care, and you've heard this before, that focuses on providing patients with relief from symptoms and stress. The goal is quality of life for the patient and the family. I added the loved one in, that's not their definition. So again, we have this specially trained team, doctor, nurse, In Hawaii, we try for social worker and chaplain that work together with patients, other doctors, and other providers to provide this extra layer of support. Really interesting work being done right now, looking in a few places, and I hope here in Hawaii, could community health workers be a part of the palliative care team? Again, thinking about the bridge. And then it's important to say that palliative care is appropriate at any age and any stage in a serious illness, and it runs alongside with curative treatment. So it is based on the need and not the prognosis. So one important difference with palliative care from hospice care is it's not necessarily for someone who is sick and dying. It's someone with very serious illness. It could be that a person will transition into hospice. It could be that a person gets better and doesn't need that treatment anymore. So it's not necessarily pre-hospice. It's certainly not necessarily end of life care. If someone's disease progresses and then they are no longer going to try curative treatments, then they could transition into hospice. But we're trying really hard to get people to understand that palliative care is not the same as hospice. Hospice is the gold standard for caring for people with serious illness who have stopped curative treatments and are coming to the end of their life. But palliative care is in a different place. What we unfortunately see in Hawaii, which is why we want your help, is that a lot of times these referrals to palliative care come very late. And a lot of referrals, people are already appropriate for hospice. So if you can help us move these conversations upstream, that would be great. So palliative care is the big bubble, then comes end of life care, and then the last days and hours. All throughout this care, symptom management, support, quality of life, pain and symptom management, all of that is happening. But it looks different at different phases of life. So because this is because you folks are professionals, we also pulled together some of the research that's showing the benefit of palliative care. So the first study here is a 2010 study for lung cancer patients. And what they saw was that people who got early palliative care, and that ran along at the same with their curative treatments, they not only had less depression, improved quality of life, but they lived 3 months longer than those who did not. So I'll go forward and then I'll come back. This is the increased survival that came out of this study that Joan Tenno did. And people have said, if we knew a medication that was going to help people live 3 months longer, we would all be investing in that company and get rich. But somehow with palliative care, that hasn't necessarily worked, that people live better and live longer with palliative care. The second study, that's also one of these classic studies, is that that palliative care can help improve the patient and family satisfaction, increases the time spent at home, and can reduce the amount of time patients spend in the hospital. So that's clearly what people want. And then if we think also if there's any cost avoidance, well, certainly palliative care could be helping with that. But what we try to focus on is the quality of life. Another interesting early study, but one that is really important in our field, is that we could show that even if people didn't live longer, what palliative care was able to do was to improve quality of life through reduced pain and distress, the other healthcare, other quality of life indicators. Patients and families tend to be very happy with palliative care. people have more chance of not dying in a hospital, and then they have less, a shorter stay in a hospital. So this is a very nice chart that comes from CAPC, the Center to Advance Palliative Care, that kind of summarizes this. And these are, you know, in public health, we're always talking about triple aim, quadruple aim. You know, palliative care for me is very much about this. So we're increasing quality of life, decreasing the symptom burden. So as they say, 66% reduce in symptom burden. 93% of people who of families and people that got palliative care are likely to recommend it to others. That is really important. And we know now there's a lot of new quality measures that are looking at patient experiences. 93% of people would recommend it to others. And then looking at utilization and avoidable spending, this is inpatient, 48% reducing readmissions and 28% cost per day. Outpatient, 50% reduction in admissions and 35% reduction in emergency room visits. With skilled nursing, huge, almost 50% reduction in transfers to the hospital and to the emergency department, emergency room, and then for home-based settings, 36% reduction in cost. So all sorts of good things can happen with palliative care that are things that we in healthcare and in public health are interested in. And then again, if we think about the various aspects of why this is important, we can see that this helps everybody involved. So people with serious illness, they are better off. We talked about the symptoms, peace of mind, quality of life, that's better. Loved ones, families, caregivers, they feel more supported and better equipped to help their loved ones. And then clinicians, much better professional satisfaction, less burnout, because they feel that they're listening to patients. They're able to put a care plan in place that matches what matters to the patient and what the patient's issues are. And then from a healthcare system, also much better because the workforce feels much better. They're much more supported. They're doing work the way they want to do it. I don't know how many people have said, I got into palliative care because this is why I got into medicine initially. This is what I want to do. I really want to be helping. I really want to be helping patients. So especially right now, when we're listening to all of the crisis that we have with the workforce shortage, if we can help people to address these issues, you can take care of people with serious illness well because you have a team and you have that support. So I pulled together, and I'd love to hear from you guys. You can put it into the chat, for instance. These are some of the messages that have come out. So based on what we were talking about palliative care, which of these things do you think are the most important? Is it quality of life? Is it a team approach? Did you like the extra layer of support? What is it that speaks to you? I wish I could see people and I could call on you, but I can't. So we need you to speak up and to share in the chat what it is that, which of these messages works for you. So Hope, I see one brave person has spoken up.
Quality of life, relief of pain and stress, symptom relief, staying at home.
Staying at home. Okay, good. That's good to know. Is the extra layer of support, is that good? Does that resonate with people?
Extra layer of support, team approach.
Okay. Does it matter that you can be getting it at the same time as other treatments, this kind of providing alongside? Is that important? Diane says no. Because for me, oftentimes when people, like if people have cancer, they'll say, oh, but I don't want to do palliative care because I'm still doing chemotherapy, or, oh, I'm doing radiation. But you can be getting palliative care at the same time. as this? Can you think about that? So it's interesting what, again, there's no wrong answer. It's what resonates with you. So great. Thanks for sharing.
Staying
folks.
out of the hospital, decreasing medical costs. Financial burdens can be stressful.
Yeah,
Absolutely.
absolutely. Best solution is helping patients heal. People need to understand that they can continue to get as well curative treatments as well as getting added support. Yeah. Good. So it sounds like these messages are on the right track for you guys with our self-selected audience. So I'm glad, because we're definitely trying to figure out how we can talk about this. Okay. Excellent. Good. Okay, so we'll move forward. So we have a couple more catchphrases that people like. Helps you live as well as possible for as long as possible. That's Dr. Steve Pantelat, who's at UCSF and one of the kind of heroes in our field. And palliative care is care the way it should be. And I think that is from Ira Byock, but also our own Hope Young. And interestingly enough, so part of the challenge, as I said, is people say all the time, well, you should call it something else. Can you find a new name? Well, what would we call it? And to be honest with you, the name is not going to change. There's an Academy of Hospice and Palliative Medicine. People get board certified in palliative care. There's a journal of palliative care. Like, it's the way that it is. And then Ira Byock, who this is his phrase, he said, if we called this the Rainbow Connection and free beer for lunch, people would still be hesitant because we're talking about serious illness. So part of this, we think, is let's embrace palliative care and make people see how it can be helpful. Okay, so Hope, we're going to show the interview with Andrea, and then you're going to do the
Case study. I'll give you a break.
case study. Yes, exactly. So just, you want to introduce Andrea maybe a little bit, and then.
So, yeah, sure. So this is Andrea Bacos. She is actually from Maui, and she is sharing her story about her husband, who actually was flown from Maui to Honolulu, where he received care from Queens, who has an inpatient palliative care program. And so we've briefly condensed this down so that we have a short enough snippet so you get an idea of how valuable this was for her and for her family. And we'd love to hear your thoughts on this. This is the first time we're airing this publicly. So please, your feedback is most welcome.
Okay, here we go.
Aloha, Andrea. Thank you for joining us today. We really appreciate you sharing your experience with palliative care. When you first heard about pain and palliative care, what was your first impression?
Any journey, if you have a heart problem, if you have any battling that you're battling, any type of illness that you're battling, pain and palate should be in your guys' care, in each patient care treatment, if you ask me, because pain and palate plays a huge part, huge, to where it is emotional. He played a super emotional support system for us, not just with my husband, but with me and the kids. I have 2 kids, along with pain. And pain and palate actually got him to open up and actually tell his deep soul bearing emotions or feelings, about whatever to call him, my husband's growing up days, he bought out. And as a wife of 28 years, he would bring some out, but it was too hurtful for my husband to talk about. Well, here comes Dr. Fishberg. And my husband just poured it all out to where it put that at ease, at rest. It supported me emotionally, a lot emotionally, because I never left my husband's side for 4 years. When he got diagnosed, I'm the one that took him to Queens and never left. I stopped working. And Pain and Palate would come in, and they would, like, tell me all the services that they will provide by my husband, but they also would say, Mrs. Bacchus, do you need anything? Do you want to talk to somebody? Or they would actually talk to me in the room. They were like, how you doing? And you don't really recognize, but you're actually pouring out your heart to the stranger because you're scared. Like, I was scared. I was scared. I knew my husband was a very sick man, and I didn't know how to handle it. And I did my hand holders. They held my hand, and they continue to hold my hand now, even till today, this present day. My husband's been gone for us. He died December 30th, 2021. And Pain and Palate and Navigation continue to hold my hand through this journey. Even though my husband's journey is done, mine and the kids' journey aren't done. I talk about palliative care all the time. I have had family members here in Maui battling cancer, same time with Lance. And the first thing I brought up to my aunts and her caregivers, which is my aunties, does auntie have pain and palate? Call the Pain and Palate Care, because they Pain and Palate doctors talk about pain and palate. It's not just for pain meds, guys. They do everything from emotional support for the patient, to families, to wives, to kids, to just a family foundation.
Thank you again for sharing your story with us.
Thank you.
So as you'll notice, it was edited down. If you'd like to see the full version, it is on our web page, our YouTube page. You can see the full 17-minute interview with her. You'll notice she did change the name, and so it's fun to hear her call it Palliative Care. She's also currently training to become a community health worker, because she found value in the people who are supporting her, and she wants to do the same for people in her community. So we appreciate Andrea's story, and she's a big advocate for getting palliative care. So please feel free to put your comments, your feedback in the chat room. We'd love to hear what you think, and if you think this was a good video to be sharing. Okay, so we are going to talk about a case study. The case study is Laura is 72. She enjoyed her retirement until she noticed she was having trouble keeping up with her friends on their walks. She went to her primary care doctor and then a heart specialist, who found out that she had had a silent heart attack. A few weeks later, Laura had another heart attack and ended up in the hospital with heart failure. And a nurse, Nicole, came to see Laura. Nicole explained that she was a nurse on the palliative care team, which meant focusing on helping people live well, even with a serious illness. And Nicole asked Laura what was most important to her about her care. She then arranged support that Laura didn't even know existed. And that included giving her medication for nausea, helping her with how to talk about her illness with her grandchildren, and a social worker to provide support to Laura's husband. A few weeks later, after starting palliative care, Laura is starting to feel normal again and back to enjoying the many activities that she used to do. So, as you can see, palliative care is not necessarily end of life care. It's helping throughout a serious illness until the person is able to care for themselves as they once did. So again, we're big advocates for palliative care. You can see that that's what we do. We promote it, but we want to make sure that you folks have this information in your toolbox, so that should you come across people with serious illness, you do have something to suggest for support. Jeannette, you want to tell us about where we can find palliative care?
Absolutely. So hopefully now you're thinking, oh goodness, where do we find palliative care? How can I get palliative care? We're happy to say that here in Hawaii, we have recognized the value of palliative care for quite some time. And we're also very cognizant of the fact that we need more palliative care. So on our website, we have this where to find palliative care in Hawaii. Hopefully that's clear. It's a button that's there. And so if we think about, there's sort of three different places to get palliative care. One is inpatient. So Queens, especially Punch Bowl, has a very robust palliative care program throughout the HPH system. Straub, Kapiolani, Palimomi, and also to a certain extent at Wilcox on Kauai. Kaiser has inpatient, and Castle, Adventist Health Castle also. Outpatient, it tends to be more in the oncology realm. So Queens has an oncology clinic, Straub and Palimomi oncology clinic, the Kapiolani pediatric has outpatient, and Kaiser's outpatient is under construction, soon to be opened, we hope. And then the final question, and really one of the biggest gaps that we're looking at, is how to get palliative care at home. And that is at the moment insurance specific. So it does matter what kind of insurance you have. I was talking with a doctor yesterday who said he was advising one of his patients to change insurance because he was hoping that he would get the palliative care coverage. So there are agencies that provide extra palliative care programs. So for instance, on the Big Island, Kupu Care, which is part of Hawaii Care Choices in Hilo, they have a palliative care program. Navian here on Oahu has a palliative care program. Bristol has something called AIM. Each of the different agencies has something a little bit different. So the way it works in Hawaii is that the agencies that provide palliative care also provide hospice care, but they have separate teams, usually have separate teams and separate training. So they recognize that palliative care is different than hospice care. And it's almost two lines of business for them at the hospice. So again, you can get the list on our website. But if you're thinking, okay, who provides in-home palliative care? Think about the agencies that also provide hospice care. And then it matters what kind of insurance you have. And my suggestion always is to ask. So actually, if you're in Hilo, there's two pilots running in Hilo. Both United and Ohana have pilots. On Oahu, HMSA, UHA, and the VA have a home-based palliative care program. So it is, and again, both United and Ohana are very excited about expanding, but they haven't yet done that. So it does matter what your insurance is. Are we working to change that? Yes. We need your help. We hope that that we are working towards a tipping point where those changes can be made. So again, if it's inpatient, most of the major hospitals have. If there's a cancer outpatient clinic, and then this home-based palliative care is really what we're working on.
Kathy had a great comment. It's a challenge to dispel the notion that palliative care means end of life. They can't help but equate it to hospice care. Unless they really understand what palliative care really is, it's too scary for many to accept. So education is very important. Absolutely. And that's why we want to make sure you have the best information to provide the people that you help to service in the community.
Yeah, absolutely. And so we've just done all this. Palliative care is not the same as hospice. You can watch the video and then you say, who provides palliative care? Oh, the hospice agencies. So, okay. So at least we have, and I will say other states are like, wow, how did you get HMSA to provide this benefit? What did you do? It's so great, all of that. So, okay, yes, we have the challenge that hospices, that these agencies provide both palliative care and hospice, but okay, at least we have something we can offer to people. So Kathy, totally agree. Again, it's a real challenge. And we're this, what we've heard and what we see is to be, it's a balance, right? We never want to deny that hospice exists. Hospice is fabulous. Hospice is great for that end of life piece. Palliative care, but so we need the balance between here's palliative care. It's not hospice. It's palliative care. It's really great. And if the treatments don't go well, then hospice is here for you. So yes, so welcome to our world of nuance and balance. And I'm so glad that you folks could be part of our educational team. We got to figure out how we can help people, because not very many people are asking for palliative care, especially outpatient or in-home. So we actually created a palliative care awareness working group almost 2 years ago, because we recognize that people don't know what palliative care is. And what we did is we sort of started with two things, and I'll talk about the second in a minute, but we thought, do we start with the professionals? Do we start with the public? And we actually decided to start with professionals, because we don't want that somebody goes to their doctor and says, hey, I think my mom would be appropriate for palliative care. And the doc says, of course not. Your mom's not dying. Why would that happen? So we recognize that we have to educate doctors about palliative care, and the providers, and people that come in the healthcare world. And we need to educate the public so that we have a bit of advocacy going on. Where's my palliative care? I want more palliative care. So we have this balance. So one thing we did is we really tried to increase and fortify the Kōkua public facing web pages to give information about palliative care. So these are the 4 pages that we have. So for patients and families, what can palliative care do for me? Is it right for me? Where do I find it? So we have a combination of videos, different FAQs and quizzes and other resources to hopefully help break the barrier, break the ice, get people to see what palliative care actually is, and then where to find it. So we would very much welcome any kind of feedback from you guys about what you think about those pages. So as I mentioned, we created an awareness working group. One of the important things, and we'd love your help with this, we created a whole toolkit that helps providers increase referrals to palliative care. So there's a workflow, there's a screening tool, there's some clinical triggers, there's a brochure. We're happy to share it. And we've been trying to get people to listen, and we haven't had so much uptake. When people actually say, oh, Jeannette, okay, you've been bothering me to do this, let's listen. They're like, great, how do I do that? But so far, we haven't had so many people. So this is, these are doctor practices, federally qualified health centers, any kinds of clinics or places where people are actually doing referrals. We can help to make that easier. So I hope you'll let us know. Last year we did an Instagram campaign with 3 West Oahu, amazing West Oahu students. They were fabulous. You can go on our website and see some of the great stuff that they did. We're really trying to get more patient advocacy groups to invite us to talk about palliative care. We've started with the cancer world. So we did a webinar a couple months ago that was really well received. And we're going to be talking at the Cancer Survivorship Conference that's coming up in 2 weeks. And have a table and talk to people. So, but a lot of other groups have been really hesitant. We're back, like the point being, oh, this is the same as death. This is hospice. We don't want to scare people. Well, how do we educate people to let people know what's coming? So some of the interesting things that are coming is, and one thing that we think is really going to be a game changer is our MedQuest office, which is, MedQuest covers over 1/3 of our state at the moment. They are actively working with CMS to get them to approve a palliative care benefit. So the paperwork, which they've been working on for 2 years, was sent up to CMS on Monday, on Halloween. I thought that was great timing. And now there's 3 months of back and forth with CMS. So by mid-January, we should know whether or not they're going to approve what is a very robust palliative care benefit. That would mean that all 5 health plans that take care of MedQuest members would have to provide this robust palliative care benefit. So This is great. And right now we're in the phase of, we want to educate people this may be coming. We want people to get ready. One of the things we learned from California, where they also have a Medicaid benefit for palliative care, is just because you build it, they will not come. So we're right now in this phase of, okay, this is coming. How do we get people on board to get excited as we are? So we're interested in both the professionals as well as the public to learn more about it. So again, please come and talk to Hope and I about it. And then we have all sorts of continuing education opportunities. Vital Talk is one example. That's a communication training. So, you know, those are things that are happening. And if people want more education, let us know. And then Hui Pohala is a new coalition that's been started to be specifically looking at workforce development issues. And you can find them on their website there. So Hope, I'm going to kick it over to you now, so you can just remind people or tell people about some of the other services and resources that we have available.
Thanks, Jeanette. So we have done a few training with the Hi-Fi Training Hui. I'm sure they have the recordings available somewhere, but we do active trainings, in-person trainings, interactive trainings on advanced care planning, which includes information on advanced directives and POLS. We want to make sure that folks understand that there is a difference between these two documents, and it is very important to have both. And we want to encourage folks from age 18 to get started at this. We don't want to wait until you're 40 or 50 or 60 and say, we want this to be something that people do throughout life. Advanced care planning is something that should be done regularly. We also have information, and we do presentations on hospice, as well as grief and bereavement. So we also host the Bereavement Network of Hawaii. If you're interested in getting connected with them, we are happy to hook you up with them so you can join us for the monthly meetings that they do. And why is it actually important to talk about advanced care planning? Well, you can speak up and have a say in your care. Getting healthcare often involves choices that impact your life and well-being in different ways. And treatments only work if they work for you. But my why is it so important is this is a gift for your loved ones. This is an opportunity to have meaningful conversations about what matters most to you, and make sure that your loved ones know how to support you should there be some sort of serious illness or diagnosis. So we really want to, if you have a desire to learn more about that, please reach out to us. Again, we do have recordings available on our YouTube page, but we found that recordings don't necessarily help people to get the whole gist of things. So we want to be able to be available for you folks if you folks need any assistance with that. On our website, we have various tools that we suggest for doing advanced care planning. We have a starter kit that's from the Conversation Project. Thank you. Conversation Project. They have done many different toolkits that you can download for free, and they share that with anybody. It's free to download. We have most of those on our website, but we also have including things like choosing and being a healthcare agent, a letter to my doctor, our advanced directive and materials that have been translated into 10 different languages, along with post forms and materials that have been translated into 10 different languages. With the translations, we do recommend that if you're going to use the translations, by all means use them, but put it onto an English document so that anyone who gets it can read it. If you find that your staff or yourself would like additional training for this, reach out to us. We're happy to do these types of presentations out in the community, and we want to make sure that you folks, you as our public health Hui, have the tools that you need so you can do what you do well. We want to make sure you have the resources to be able to do this. And that's really what we want to do is, again, you have the full staff of Kōkua here. So you have both of us here. We are a small nonprofit as far as staff wise, but we have a large reach, and we want to make sure that you have the tools that will help you.
So I'm going to interrupt Hope, which
Yeah,
I'd
go
like
ahead.
to do. No, so one of the things that came out from this national research that was on this Wednesday morning call was that a lot of people know what they've heard of advanced care planning, but they really don't want to do it. And in my world, that happens a lot. Like, oh yeah, I went to one of your lectures. Like I went to one of the lectures before the pandemic. I thought it was great. I took the file. I didn't do anything with it. Now you gave me another one. I still haven't done anything with it. So it was this really interesting conversation about what is advanced care planning? Should we get rid of that term? Do people even know what it is? And so this terminology was to sort of to say, like, we need to say, like, making your wishes known. And like Hope always says, who are your people? Who would show up for you? And that is probably the most important thing. You know, if you get hit on the head by a surfboard, who would speak for you? Who would your agent be? Who do you want to show up in the emergency room and speak for you? And those are things that people can be doing now, and they need to do at 18 because their parents don't get to speak for them anymore. So just to let you know, part of this challenge that we have is so many people say, oh, it's good, it's important, it prevents crisis. Like, I don't know how many times families have said, oh, it was so good that you did that. Or, oh, I wish we'd done that because then we had this other thing. But yet people don't do that. So we are really interested in enlisting you to help us to figure that out. So,
And as a good reminder, it's also important to point out, just naming your healthcare agent on an advance directive. You don't have to complete the entire thing, but just naming your healthcare agent is a step ahead of the game. Without naming that agent, then they have to go through all this guesswork and some hoops and try to figure out who's in charge. And if you're anything like me, I'm the loudest person in the family, so oftentimes I'm the one that speaks up, but you want to make sure that they don't have to fight amongst themselves to try and figure out who's in charge. This is really why we want to make sure that you have that opportunity to name your healthcare agent. And why don't we do a kind of an impromptu poll? If you have your advance directive, can you just pop it in the chat? Let us know. There's about 59 of you in there, so we'd love to hear whether you do or not. Okay. And I'll let you look at those, Jeanette, if
I'm
they start coming
looking.
in.
So far, nobody's outed themselves.
Oh, got a few yeses.
People
No,
may not.
no.
Maka, not yet. Anna, yep. Don't worry. You know, Hope, one of the, maybe you should tell your pie story from Rosemary for the upcoming holidays.
So it is National Hospice and Palliative Care Month. Or is it Palliative Care and Hospice Month? They go hand in hand, but
yeah.
We had the Reverend Rosemary Lloyd come in from the Conversation Project, and she shared a story. She was doing end-of-life conversations in her church. She was doing those sermons, and she encouraged her parishioners to have these conversations. And so one of them got so excited, she came up to her and showed her what her had the time and a date for Thanksgiving dinner, had all the information. And at the very bottom, it said, there will be no pie until you tell me how you want to die. And that was just a brilliant way of trying to introduce the conversation into an opportunity where everybody is together and they're enjoying a meal together. So again, it doesn't have to be scary. It doesn't have to be kind of like, ooh, I don't want to talk about that. It's not bocce. Remember, no one gets out of here alive. The only things for sure are death and taxes. So we want to make this a common conversation that's not so scary, that gives people the opportunity to really talk about what matters most. So again, we want to make sure that you have that opportunity. If you don't have yours done already, you can go ahead and say, Kōkua Mau gave you homework that you need to complete your advance directives.
And it's also good, you know, with the holidays are coming up, people may be coming back home, you know, take an hour and have some conversations. And, you know, we're talking about palliative care, the important role of the family, making sure people understand decisions. It's so much more helpful if people have had conversations before to figure out what's important to them, what matters most to you, and who's going to be speaking for you. So we put it out to you as a challenge with the holidays coming. Think about getting, at least having your think about the agent, who's your person. I also want to say, congratulations to all of you. You just saved $400 because we have free forms, unlike lawyers who charge a lot of money. Our form is very well respected, used all around the state. People really like it, and it's totally free. So don't let a lawyer talk you into using their form. There's a lot of, so there we go. We saved you money, and we're hopefully also, hopefully helping with preventing a crisis. So, and Kathy says, I think it's a great idea to start with declaring the agents. Yeah, start with that. And, if you can think about who would speak for you if you couldn't speak for yourself, but you're not dying, you're not in a life-threatening situation. So, and then Kathy, it's also important to say you can have either 2 witnesses or a notary to make the advance directive legal. So sometimes people find it much easier to go and get it notarized, but it can also be 2 witnesses. And then just since we're still on this advance directive, make sure that you've shared it with everybody who you care about and who cares about you, and that it's put into the electronic medical record with your doctor, and it's not locked up in the safe deposit box with your will and your trust and whatever. So think about the advance directive as being a more living document. Okay, Hope, I'm gonna stop talking, and now it's your turn again.
So because we kind of talked about the differences between palliative care and hospice, we want to make sure that it's very clear what hospice is and the difference. So this is for care for the last phase of life, which should include the whole person and all the people who matter. So hospice is not just about the person who is facing death. Hospice is about the whole family, all the people who support them. It's making sure that there's support in place for not just that one person, but for the entire family. And that's just one of the benefits of hospice. My mom, when she found herself in a place where it was time for hospice, I introduced it as the Cool Kids Club. And my mom was a teacher. She taught elementary school for, I'd say 40 some odd years. And so I told her, Mom, you've been invited into the Cool Kids Club. And her eyes got really big, like, what's that? And I said, well, in the Cool Kids Club, you get your own doctor, you get your own nurse, you get your own social worker, you get your own spiritual advisor, and you get your own aide. And these are the people that are going to take care of you. And she said, I want that. Now, I wish I could rename hospice to the Cool Kids Club so everybody can recognize how great the service is. That is the gold standard. That is what people, can really benefit from. We hear all the time from, I've heard now, 3 getting kicked out of hospice 3 times. Before this, it was only 2 times, but I've heard 3 times now. So, it's not just for somebody at 6 months, because doctors are kind of guessing prognostication, right? They are guessing on how long you're going to have. But if a person is at that stage of life, they will go ahead and extend it. And they'll extend it for as long as that individual needs. And then you hear about those people who have graduated from hospice because they've gotten better, because they got the best care possible from the hospice team. It's really important to recognize that calling hospice early is really beneficial, not just for the individual, but for the family, for getting comfortable with the situation. Again, with those 5 team members, that interdisciplinary team, people can get really good care. And that is really something that folks should be expecting. So if you want to be at home, hospice will come to your home, wherever you call home. So whether that's in a facility, whether that's in your home, hospice is it's a service. It's not necessarily a place. And if you need sorting out your medications, hospice will figure it out what you need. And again, there's that spiritual care. The hospice teams include chaplains. So we want to make sure that, we want to make sure that you understand what hospice is, and that when you convey the information about hospice, to recognize that folks can live longer lives with better quality care in place. So their quality of life is actually extended because they're getting the best care possible in their home setting. So by all means, please visit our website so you can see more about hospice providers. We do have additional resources that are available for you. If you are not signed up for our newsletter, please go ahead and let us know. You can drop it in the chat, or you can send us an email, or go to our website and sign up for the newsletter. We like to publicize everything that's going on within the community in our space and share those things with our subscribers. So we do offer opportunities for CEUs, CEs, other presentations, special echoes. We do that. We publish all of that in our websites. We do have, again, I mentioned it earlier, translations of our materials into 10 different languages. We are hoping to get more languages soon to support the Pacific Islanders. And we want to make sure that you know that we are a resource where you can find additional information. If you want a speaker, we have speakers, and I get the joy of working with our ambassadors. My ambassadors are social workers, they're nurses. I even have a few retired docs. They see the value in the work that we do, and they volunteer their time to put this message and information out there into the community. So we are happy to put on presentations, whether it's via Zoom or in person. Please reach out and let us know. And these are the resources that we have that have been translated, and the languages are on the website, so you can go ahead and download it from there. And we encourage you to utilize this, get familiar with it if you aren't already. And if you have questions, by all means, you can reach out to us. Jeannette, did I miss anything on the resources or anything else?
No, I didn't put the picture of all of the stuff from the conversation project, but people can go and find all of those starter kits and all that stuff on there. So, and, you know, folks are looking around, you can also, you know, let us know if you find other things that you think are useful. Okay, so one thing I did want to say, as you were talking about hospice hope, one of the things we want people to know is that unfortunately in Hawaii, we're kind of at the national average with hospice, meaning about 50% of people who have Medicare, 50% of people who are older die with hospice care. But that means 50% of people don't have hospice care. And then the other thing that's also very frustrating is that people have a very short length of stay, as we call it, length of time that they're in hospice. So sometimes people are in for a few minutes. I talked to somebody last week who the hospice was on their way to do the admission and the person died. And the family was just waiting. They were waiting. And my suggestion really is to call the hospice, like Hope said, call the hospice, get people talking, find out what they're going to do. You're gonna hire them to come into your house and take care of somebody. So you want to understand what they do. But I often find that helps relieve people's fear, because then you can see, oh, wait, you're going to come and support me and my family. I mean, I get some sleep. Somebody's helping me with the meds. Somebody's helping to bathe mom. We really would love to get higher usage of hospice in our state. And like Hope, both of my parents died in hospice care, and it was really fabulous for our family that we had that support at the end of life. Okay, so Hope, this is I think our last slide.
One more additional thing for that. It is a Medicare benefit. So it's important to recognize that although it sounds really expensive for people to get hospice, it is a Medicare benefit. So it is something that's covered by Medicare. So its cost should not be a reason not to call hospice.
That's exactly right. And the other thing that we've learned is that hospice also has they tend to do fundraisers for people who may need some extra support or some extra help. They also, most of them have a fund, for instance, for funerals or for other kinds of support along the way. So hospice is really a pretty an underutilized benefit and service in our community. So want people to know about that as well. Okay, so any questions, comments, anything you guys want to share with us? Kathy has a bunch of good comments. Oh, she loves the booklet on advanced care planning. Yes, we've given away 40,000 of those. So now we need somebody to help us pay for printing again of that. I'm glad you like that. That's good to know. Any other comments or questions for Hope and I? I hope people feel inspired to talk about palliative care and also to do their own advanced directives. I think that, that's another start. Again, if people are interested, like Hope said, and having having a training, having more conversation, that would be really, we're happy to do that. Erin, you wrote that you wanted to know more about community health worker resources. Hope, you want to just tell some of the trainings you've been doing with community health workers?
So we have been working with Papa Ololokai, who works with community health workers. And they have been doing training for their community health workers. Right now, my understanding is the program that's available for training community health workers is being funded. So if you know people who are interested in becoming a community health worker, there is free training available right now for those people. So it's definitely a field that we are happy to work with. They're the bridge in our community. They are the bridge. So we want to make sure that they have everything that they need to be able to touch on all the things that they need, to have the resources that they need. So we've been doing training with Papa Ololokahi. What was the other one that we did? There was another.
I think we were going to also do something with the Hawaii Public Health Institute. Yeah, that's coming up.
You're right.
Especially around advanced care planning, because people may think, again, that it's something that it's not, and you can ask questions and people be listening and helping with that work.
Yeah, we see community health workers as such a valuable asset, and they're doing that bridge work. Doctors don't necessarily have the time to have these meaningful conversations. They're stressed to get you out in 10, 15 minutes, right? So how do we get these people who are on the ground, boots on the ground, how do we get them trained up so that they can start having these conversations with the people that they've already built a rapport with, so that they can help their community? And that's really what we want to ensure that community health workers are able to do.
And we also know a lot of people are hesitant to ask their doctor stuff, or they'll ask the community health worker things, or it's like asking a family member or not. I always think of my dad. Dad, how are you doing? Oh, great. Couldn't be better. Let's see. This is a man with congestive heart failure who's going to have a toe amputated with gangrene in hospice care. Doc, I think you should know that my dad has some other things going on, but no, like it's not what he would bring up. So I think if we can figure out all these different folks, especially people who are trusted out there to help them understand, that would be great. So I don't see any questions.
Yeah, I don't see.
Hope and I are here.
Oh, I know. If again, folks, you have the chat box or the Q&A box that's on the bottom screen if you folks want to pop any questions. But I think you both gave such an informative presentation. Like I'm over here thinking, what kind of questions could we ask? You folks went front to back, and so I thought it was
told
but
stories.
I did have, I just want to bring it up. First of all, calling me out about having an advanced care directive. Okay, good to know. I am turning 30 soon, so it's a good idea to probably have it. But I'm over here like with this youthful mind thinking I have so much more time, but time is not that of the essence. I kind of wanted to pick both of your brains because I know the holidays are coming up, and when families are gathering, sometimes these are the only moments you'll get everybody gathered at one table. It's a hard conversation to have, but it's kind of necessary. What advice would you folks have, maybe in terms of setting the mood? Like I can just speak for myself. I have very hard-headed family members, and sometimes they like to mumble to themselves and don't think I can hear. But it's just like facilitating a space where they feel
we
open.
must be related, Maka.
I think so. I think it's my dad, his caveman ways. So like how would you folks recommend facilitating that conversation where it is tough but necessary? Like are there tips, are there strategies? yeah, maybe set direct setting, who's the kind of person to kind of start it off?
First off, I would say you don't want to just drop it on them blind. That's when you get them like, nope, I'm not listening. I can't do this, or they'll just walk away. You want to kind of prep them for it. And my suggestion is start with your own wishes and your own things. Say, I did this. So it's no longer a matter of age, right? It's no longer saying, hey, you're getting to be old. Can you do this? So if we start with ourselves and say, hey, you know what? I did this and I learned so much from doing this for myself. I just wanted to share my answers with you. Hopefully that'll open the door to having more conversations. But if you start with, hey, you're not doing so well, and we'd like to figure out who's in charge, that never works. So start with yourself. Don't just blindside them with the conversation. And remember, you might have to try a couple of times. You might have to come back to this, and they might be, I'm not ready to talk about this. Okay, you don't have to tell me your wishes, but I want you to know mine, just so that I know that you know how to support me.
I agree that you start with yourself. And so you could imagine, oh, you guys are coming. Hey, Hope and Jeannette wanted me to do this. No, you can say, and I have some things I want to share just in case something happens, because we've been doing this at work or whatever. I think it's important, or I love you guys very much and I wouldn't want you to have to fight. And all the stuff that we have online, especially the starter kit, you can fill that out, make a PDF and share it with everybody. Like, I just like, a few minutes to talk with you guys about this, so or this is who I've chosen to be my agent if something happens. Just so that you put it out there, you've got that going. I will tell you, I had a talk with my agent a couple weeks ago, and I was almost in tears because she did such a great job. I'm thinking I need to record her. She was so good at like, okay, I hear you saying this. Is this what I hear from this? Like, we did the starter kit. And it was like, oh God, my husband's going to be supported. She hears what I say. She asks what matters to me. And okay, I'm not alone, because we don't have any kids. So it's like, oh, but kids could be the big problem anyway. And both my parents have died. And like, wait, I have a husband and a friend who are going to step up and help me. So it was actually really fabulous to do it, even though, I do this work all the time, but to do it for myself and to hear, Pat heard me and she's going to speak up for me. That was really reassuring. So I agree with Hope, and warn people like, okay, I would like half an hour to just show you what I did, see that you get questions answered and whatever. And probably if there's a grandma or great grandpa or uncle chemo who, people will say, oh, did you guys do, so it may help. But I think starting and like Hope said, warning people, and also try and find like a time where like you never want to do it, oh, you're dropping the kids off, picking up the dog, here's the whatever, like these are some really important conversations. They are some of the most important conversations. And when I look back to like with my mom, when my mother had a brain tumor. So at 63, she was at work one day and had a seizure, and she died 2 years later. But this was a very healthy person. I would have said she was going to live to 92 like her mother did. So you never know, but we had some really amazing conversations that I carry with me. So it's okay to say, I want to talk to you guys about some important things. Sometimes people say, if you want to talk to teenagers, you get in the car and you drive so they can't jump out on the freeway. So it's up to you, right? That could work too. And also if you're in a car, then you're driving forward and you're not looking at places, right? So, and again, hopefully it can help you to be, if you do your own, then if you do have an elderly loved one or a person who's quite sick and you're thinking, ooh, we have not had these conversations, this can also help. Again, in Hawaii, we think, we are taking care of each other, and this is really, it is a gift to your family. And I don't know, Hope and I both have so many stories of the good where people say, oh, I'm so glad I had these conversations. And then people say, I haven't talked to my brother for 20 years because whatever. There was misunderstanding. He tried to kill my mom. He tried to do whatever. Like, oh my gosh, there's so much stress. We just need to avoid that right now.
Mhm.
The other thing I would suggest, Maka, is start with who do you choose to be your agent? Like for your dad, just say, you know, I know you don't want to talk about this, but if you got hit by a bus, if you fell down and hit your head and you're in the hospital, nothing age related, not age related,
Surfing.
if you went surfing and you got wiped out and that board hit you on the head, they had to take you to the hospital, who would speak for you? Who would you want to be the person to speak for you?
And I think you both bring up really great points. But okay, so then I'm like kind of want to throw another dodgeball, Kurt, because you're saying
Good.
all these conversations. So what if it's to the person? Okay, it's my turn to therapy for me. One of my closest friends, she's becoming. No, we're at the stage where we're turning into the caretakers, especially because we have families from Neighbor Island. Like some folks, their kids moved away, but the families are near, like the grandkids are around. So like the kuleana starts to get, put on our shoulders. And then eventually, we step into the role of that caretaker role. But it's the agent who's having the problem confronting that conversation, like that's where I feel like, okay, do you folks have tips and strategies for like, she's the one, like, he wants to have the conversation. He wants to say all these wishes, but she's not willing to listen because I think that she's trying to avoid coming to terms of what the end would be, right? Like end of life. So like what kind of tips and strategies do you folks have as somebody kind of an outsider listening in and providing support? Because then like we know what the end of the day is, but it's the agent who has a kuleana that's starting to.
So one, is the individual still able to choose who their agent is? And if so, they might want to consider finding somebody who supports their wishes versus somebody who's going to go like this. That's why these conversations are really important, because you want to make sure that the person that you're choosing as your agent is able to stand up for that responsibility. They're able to take on the kuleana and they're able to make decisions on their behalf and they're able to advocate for that person. So rather than thinking, that's my mom, I want to keep her alive for as long as possible. That's my mom and I want to do what she wants. There's those two different mind spaces where you have to determine whether or not that individual as the agent is able to do that, because you want to make sure that that person is able to advocate for that for yourself. You want to pick somebody who's going to be supportive and acknowledge that, yeah, this is hard, but we're going to do it your way.
And I think, Maka, it's a very good point. And one thing I often hear from people, it's like, oh, well, I'm only the daughter-in-law, right? Oh, it's my husband's family, and oh, it's going to be a big mess. I can't get involved because it's my husband's family. It's like, sometimes it's too close. And sometimes they need the daughter-in-law. Sometimes you need the neighbor. Sometimes you need the social worker, the community health worker, the nurse, the other person to talk about stuff because it is too close. And that's one of the reasons we like the starter kit, because it's a talk story thing. It's like, here we are, let's just talk about this. I want you to understand what's important to me. And sometimes you need another person to help. And so it may be that, you're observing that, and maybe you have a role to play that you can say, look, there's a problem. Auntie wants to talk about it. You don't want to hear it. I'll be brave and do this. And Hope is right. Sometimes I don't know how many times people have said, oh my God, I have 4 useless kids. Who am I going to choose? Well, don't choose anybody useful. Oh, okay. Let's choose somebody else. And sometimes the family, it's too close. Our friend and colleague, Joy, she has this whole Goldilocks story where she goes to the husband and says, okay, you know me, this is what I want at the end of life. And he's like, yes, I will sit by your bedside with all machines going forever. I will never turn anything off. And she's like, that's not what I want. And then she goes to the son, and the son's like, I got it, Mom. No machines ever, no nothing. And he's like, wait, what? No, that's not what I want. And then the Goldilocks is the daughter. And she says, I was super surprised because I didn't think my daughter had it in her. But she said, okay, Mom, we've talked about these things. I know this is what's important to you. And if that's not going to happen, then we'll cry and hold your hand and put you in hospice. And so she chose based on the conversations, not on the husband and the oldest son and sometimes you got to say, okay, nice that you have so many people that love you, and who is it that would speak for you and do that. And there's another thing that Hope and I talk about in the training called the Go Wish cards. I don't know if you guys can see that. But there's Go Wish, it's online, and it's a series of cards that you can have a conversation and break the ice and talk about different things. So what you do is you come up with like cards that are important, and you think, what are the most important things? Like to be mentally aware, to have close friends, to have my funeral arrangements made. My dad and I did this. He was in a nursing home because he was in care home because he fell down, and he didn't want to talk about it because that's not what we talk about. So we kind of played the game and got the cards. And so there's some other tools too, but I just want to say, like, you can say, oh boy, that family, we're going to have a lot of problems later. Wait a minute. You just said that we're going to have a lot of problems. Try and do something about it now. It's kind of like saying, oh, if a hurricane ever came, they would be screwed because they don't have water. They didn't do whatever. Like,
Wow, you two are inspiring. This was a really great time. And so I know the chat box has been saying the same things, very inspiring stories and just wonderful advice. So kudos to the two of you.
oh,
We
well,
could
we
sit
love
here and
it.
talk forever. I feel like I could just sit
Absolutely.
and we could all just talk about these conversations and share stories. And I just think you both just want to thank you so much for your time and joining us today and presenting to the members. And just for folks who've been staying on, thank you for joining today's call. I know it gets close to the holidays, so I hope this really inspired some of the time that you may consider spending with your family around these special upcoming weeks. So just as a reminder, folks, I will be sending out a Mahalo email, including the evaluation survey, as well as the presentation slides. And I'll send a link. I'm going to add in the link to your folks' website so folks can check it out and download the toolkit and check out resources. For everyone on the call, be safe, be well, have a great rest of your Aloha Friday, and I look forward to talking to you soon. Mahalo, Hope, and Jeannette again. Have a great day. We hope everybody.
Aloha.